Coming up on today's episode of the Health Review.
The early development of the gut is really key to many things in the child's future. And that does actually begin probably before pregnancy. So the maternal gut microbiome is one of the biggest influences on the baby and the child's gut microbiome. We know that both autism and ADHD are multifactorial. So there's not just one aspect of your system that's playing a part. The gut can play a part, but it will be variable. So it won't be the whole story. There's a higher proportion of children at a certain level of kind of autism. So maybe the ones who have also lots of developmental issues. And that can't be just explained by people being more aware. So I do feel that there's both factors going on because our referral rates have gone through the roof. When a child has a choking episode, it might not put them off all foods, but it can suddenly put them off.
Hello, welcome back to the Health Review, and today we're focusing on all things childhood nutrition. It's often an overlooked aspect of paediatric care. Let's just look at the facts very quickly. So we know that by the age of 5, ultra-processed foods make up over 60% of UK children's daily calories, which is quite frightening. Deficiencies in nutrients like omega-3s, irons, zinc and B12 have been linked to cognitive delays, and gut health is also emerging as a real key player here in terms of being linked to allergies or skin issues like eczema. So today, my guest is here to help clear up some of the facts that I'd love to discuss around this. Dr. Venita Patel is a medical doctor and paediatrician who's trained also as a nutritional therapist. So we're going to get right into this, into how you can help your child with their development with all things nutrition and functional medicine. Let's get into it. Dr. Patel, thank you for coming on the Health Review.
Thank you for inviting me.
It's great to have you here. Now, you are both a medical doctor and a nutritional therapist.
Yes.
What inspired you to sort of combine those two approaches?
So I think it was growing up. I was surrounded by people who would talk about using food as one of the first interventions when you're unwell, because in our Indian culture we have Ayurveda. So it would be something from your spice box or a different type of drink, like we all probably hear about turmeric lattes. That was something we grew up with. And then later on, I always wanted to become a doctor, but I didn't realise that nobody talks about nutrition within that. So it took a while, but eventually I found the course which spoke to me. So nutritional therapy was actually something which looks more at the underlying reason for why you're seeing a symptom or why you might be complaining of something, and addressing that rather than the symptom itself.
And now you're running sort of dedicated family nutrition clinics.
Yes.
I'm curious to hear about how you got into the sort of children aspect of that, but also some of the more sort of common concerns that families might come to you with.
Yes, so I work as a paediatrician in the NHS, and so when we trained in nutritional therapy, I was looking to do more work with children, but actually we're trained mostly in adults. So it took a while to switch over to just seeing children, which is what I do now. And when we invite people to come and ask about their children, there are so many common issues, the chronic ones, which yes, we do give medications for, but they don't really get rid of what the underlying reason is for that. So the common things, there's sort of two big groups of people. You mentioned development, so either something about your child's growth, their development, something that might be going on with their brain, so whether they're diagnosed or not, they could have some aspects of autism or ADHD. So I see a lot of children from that category. And then the other big group are children with gut health related issues. So either simple things like constipation or just tummy aches which haven't been explained. We get quite a lot of children like that. They've had all the tests, been to a couple of hospitals, and nobody has found anything. So they've just been told, well, there's nothing serious. But the child is still suffering. So that's the kind of case which I love to get into. And we can help, which is brilliant.
I'm guessing it's quite distressing for a lot of parents, because when it's something like gut health, these are complex things, which I know on the NHS in the past has been quite difficult to get to the bottom of when you're an adult.
Yes.
The types of testing available, it's difficult, and it's also very difficult to treat the gut, I'm sure, especially with young children who might not want to eat, all of the crazy things, the fermented foods and the probiotics. And is that something that is quite challenging for parents when your child is facing some kind of, whether it's ADHD or whether it's eczema or something like that, to firstly get to the bottom of what is the root cause and what's the problem, but then also treating?
So that's why it is good if you specialise in children, because they are very different to, there are some fussy adults, but they are very different in terms of what they might like and what they might not like. And so you adapt in terms of, you start with what they do eat, and you start with looking at how the family functions, and you base your interventions on that. So you can't put in a whole new regime. You're working out where and how you can change things which are going to optimise the nutrition and also making any changes for the gut.
And in terms of paediatrics, why do you think nutrition hasn't been one of the main focuses, which I think now, we know a lot more now in terms of education as adults, what we should be doing, how important lifestyle is. But for children, it hasn't really been such a big focus as perhaps it should have been.
So as medical doctors, we're not trained in nutrition. And even in paediatric training, you're just looking at the extreme ends. So you're seeing people with really severe deficiencies, and you're trying to make sure that people are safe, so they're not going to get into serious ill health. Whereas most people are in the middle, they're not at that extreme end. And so if they're in the middle, they tend not to come to hospital. They tend to be people who might see their GP or might just be trying to work out things for themselves.
And for I guess it's similar with any sort of nutritionist appointment or functional medicine, that you're trying to fit the puzzle pieces together. You're looking at the root cause. What are some of the steps you might have to take with a patient that's come in or a child that's come in who is displaying perhaps some gut symptoms? What is the sort of investigation process like for you?
So it is detective work, because quite often the child can't tell you what exactly is going on. So obviously you hear from the parent what their observations are. I always like to see children in person at least once so that I can observe them, and if they're older, obviously chat to them. And then we're looking at them as a 360. So as a whole, we're looking at not just all their health history, but also things like what's going on at school, what's going on at home, what do they enjoy doing, asking about sleep, asking about what they do to relax. All of these things play a part. So it's not just the health or just the symptom that we're looking at.
How can things like sleep or stress impact a child's health?
Well, sleep is when children make growth hormone for a start. So that's an important factor because they need to have that for growth. It is also the time where the brain is essentially cleaning itself. So we have this glymphatic system in the brain, and that's when it's working to flow the CSF, which is the fluid in the brain. And it's almost like you're clearing out any toxins and refreshing things so that you can function the next day. So sleep plays an important role for many aspects of children's health.
Yeah, so important. And I had a functional medicine practitioner on the show before, and he gave an example of a child who was having all sorts of gut issues. He was having mental health problems and behavioural problems. And actually, once they found out what was going on with his diet and certain imbalances in the gut, that this child's behaviour just transformed and was going to bed on time every night. When in the evenings, the parents would spend 3 hours trying to get this child to go to bed. And, the parents have got in touch and said it's been the most life-changing thing. Do you have any examples of stories where things have really turned around for a child when you've looked at the root cause and you've had to fit those puzzle pieces together?
I do. So quite often we see children who might be on the spectrum of having ADHD, and they might, along with that, have other difficulties. So we know that quite often they can't fall asleep, similar to the case that you discussed. And they quite often also have another aspect in their gut. So when we're looking at that, we're saying, are they digesting and absorbing all the nutrients that they might be eating? Even if they're eating the best diet, you do need to digest and absorb. And even if they are digesting and absorbing, are they then able to transform those nutrients to use either in the brain or wherever they're needed in the body? So one of the biggest changes we see is quite often when we give good levels of things like magnesium, B vitamins and zinc. And so we're making sure that the gut is in an optimal state to take in and absorb those things, but we're also making sure they're getting enough through not just the diet, but also through targeted supplements, so specific ones which we know are going to be better absorbed. And when you give that combination of things, along with lifestyle, so we always talk about lifestyle. So for children like this, we would be talking to the families about what practices can you put in. So even simple breathing practices, some physical activity. So physical activity is massively important in children with ADHD. Are you giving them a variety of physical activity? When you get all of those pieces into place, we quite often hear, oh, my child is actually doing a lot better, the school reports have changed, and they're flourishing. So it's really satisfying when you get that.
Yeah, I can imagine that side of the job must be really rewarding, especially for children who, you know, we're all programmed to just love children and to want to see them grow and develop in the best way possible. And when they're not, you know, that can be really troubling for the whole family and even other children in school. It's disruptive and it's traumatic. So I think looking at that, it makes total sense, and it's a real shame. I mean, when I was growing up in the 90s and early 2000s, diet just wasn't something that was focused on at all.
No.
I mean, school dinners, I was on school dinners a lot of the time, and, you know, they were not great, quite processed. And I guess the education just wasn't really there. And I did have classmates who had ADHD and things, and it does make you wonder, you know, if the diet had been better, perhaps there would have been less disruption. But it's really great that things are changing and people like yourself are helping and educating others to perhaps look at that first as a first thing to sort of investigate. I wanted to actually ask you, with ADHD and autism in children, I kind of thought actually this would be a good opportunity to myth bust something that is being brought up on social media a lot, that some practitioners or people who are health advocates are speaking out about how gut health can cause autism and ADHD. And there's a lot of conflict about this online, differing opinions. Others think that actually there are sometimes links, so sometimes people who have autism or ADHD might have certain strains of gut bacteria. Is this something that you've come across?
Absolutely. So we know that both autism and ADHD are multifactorial. So there's not just one aspect of your system that's playing a part. Firstly, there is always pretty much a genetic aspect. And then whatever happens in early infancy and beyond, all of those factors then can play a part in what you see in a child. Definitely we know that the gut can play a part, but it will be variable, so it won't be the whole story. However, people are looking at that research because they want the magic bullet. They want that one strain that could transform things. And unfortunately, it's not really the case, because as we all are individuals, so is our gut microbiome. Yes, we might see particular strains that are higher in certain children, but that doesn't necessarily, it's not correlated with what we're seeing in the child's behaviour and development. So we should be optimizing gut microbiome, and we should be optimizing their gut health, because quite often children with autism complain of tummy aches or do have constipation. So we definitely should be addressing that. But saying that it's the only thing is probably stretching the truth too far.
That's really helpful, though. Thank you for clearing that up, because I feel like with social media, it's a little bit black and white sometimes, and actually a lot of the time you find out it's more nuanced than that, or somewhere in the middle. So there are diets that have been explored. You've mentioned gut health for things like autism and ADHD in children. Based on your experience, how effective would you say some of these diets are?
So when we're talking about specific diets, there are a few which have become quite well known. So some people think about something called the GAPS diet. Some people talk about specific carbohydrate diet. There's also people who go keto. And then the commonest change which people make is to take out certain things from the diet. Most commonly, it will be gluten and dairy, or casein at least. So out of all of those, I would say that trying a period where you do remove gluten and dairy, but making sure that you've got all the elements that you need in your diet without the gluten and dairy, is probably the one that people should try first before they step into doing any of these other quite difficult to follow diets. And my advice to anyone is, if they're going to put their child on a specific diet, is to do it with a practitioner, because without that, it really is a minefield, and you just are kind of trying different things and they don't seem to work. So I do meet people who said, we tried this, we tried that, we tried the other. As we discussed before, it's not the only part of the puzzle, the nutrition and the diet. So you do have to do it alongside all the other things. It is useful to maybe do some extra testing. It's useful to make sure you're on the right supplements. It's useful to look into other things such as environmental factors, the immune system. So there are many other things apart from diet, which is why people will say, well, I did that one and it didn't work.
Right.
So definitely try and work with a practitioner. If you can't, then just try a 4-week or 6-week elimination of the gluten and dairy.
And are you at risk with children if you are playing around the diet a bit, because perhaps there's something that you want to get to the bottom of as a parent? Are you at risk of entering a territory where they could become deficient? So cutting out dairy all of a sudden, actually we know that's quite important for children in terms of bone health and growing. You know, I'm guessing children need more of these nutrients than perhaps we would as adults.
So definitely you can risk having low calcium. You could also risk having low B12. There are certain things which we do find in dairy, but that's not to say they can't be found in other foods. So you must research what are the foods which are high in calcium and make sure you're giving enough of those before you cut out anything completely.
Yeah. And in terms of just your personal opinion, over the years, are you seeing an increase in children with ADHD and autism? Or is it, do you think, a case of there's more education now and perhaps it's a bit more straightforward to get a diagnosis for these conditions?
So there's definitely more awareness, more understanding, and people seeking diagnoses much more than they ever did. But we are also seeing that there's a higher proportion of children at a certain level of kind of autism, so maybe the ones who have also lots of developmental issues, and that can't be just explained by people being more aware. So I do feel that there's both factors going on, because our referral rates have gone through the roof, and that's not just because people are more aware.
It's interesting, isn't it? There are also lots of theories about toxins, you know, microplastics.
Yes.
It's obviously hard to really know. The evidence is very new in terms of, I mean, there are studies coming out every week about microplastics, which are fascinating in terms of finding them. I think there was one that was recently saying that they found them in most eggs that were found in IVF and things like that, brains. So obviously we know there are all these other environmental factors.
There are.
But what's your opinion on that?
So as we said, it's not just one thing, but the environment does play quite a big part, because we're not only seeing higher rates of autism and ADHD, we're also seeing higher rates of quite severe allergies, children who are literally not able to eat a list of 10 foods because of those allergies. And we didn't see that maybe even 10 years ago. So there's definitely a link to environment and how the environment is affecting the gut and the immune system. So those kind of things that all interact must be changing, whether it's just through what we're breathing in, what we're drinking, or it could be also the sort of chemicals which we are getting through our ultra-processed foods as well.
For those listening who might be concerned or have suspicions about their child being on the spectrum somewhere, you see a lot of parents turning to social media, posting reels, taking videos of their children's behaviour, putting it out into the open for anyone to give their opinion as to whether they think that this child has ADHD or autism. What are some of the symptoms that children might display?
It depends on the age. So very early on, we're looking at their development. Do they have a late development of their speech? So that could be an early sign. We're also looking at all the other aspects of communication. So that includes, eye contact and facial expressions. There are lots of subtle things that we think about when we're diagnosing children. And then when it comes to ADHD, we don't look at that until much later. So people hear that, yes, you might have ADHD, but they're thinking about it in a 3 or 4-year-old. And we know that that's a normal level of activity for a 3 or 4-year-old. So people have become overconscious of children being, normally running around and not wanting to sit for too long. And even when they get to school at 5 and 6, actually a child of 5 and 6 should still be running around, but we are expecting them to sit for longer periods. And then teachers are then considering, oh, is this child possibly got ADHD? But it's still a very young age to be diagnosing that. So I think that people should just have that awareness that there are aspects of childhood which are within the completely normal range.
In terms of gut health now, how important would you say that is in infancy? So we know that perhaps studies that have come out over, breastfeeding is preferable. Vaginal birth might be better in terms of those early moments and how you can support the gut health. How important is it, though, in terms of the child's long-term health? You see things like eczema, allergies, things like that.
So the early development of the gut is really key to many things in the child's future. And that does actually begin probably before pregnancy. So the maternal gut microbiome is one of the biggest influences on the baby and the child's gut microbiome. If you have a vaginal birth, that's the first main way which you are gathering your bacteria as a baby. And so if the mother had something like several bouts of needing antibiotics, that could play a part. And then after birth, it's what is coming in. So obviously we prefer if people can breastfeed, but we know that that's not always possible. So if you're giving something which is a formula, does it have all the components that you want to support the gut? And manufacturers have realised that yes, we do need sort of the prebiotics which are feeding the gut bacteria and some of the bacteria themselves. If a child then has an illness themselves, that can also disrupt how we acquire the normal gut microbiome. So that would be when we would think about how to repair that. So we do talk about giving infant probiotics to help recover after having a course of antibiotics. And in some countries that's done as a routine, but here it tends to be depending on the practitioner. It might be a health visitor who suggests it, or your aunt might suggest it. So it's very variable whether that happens or not.
Why do you think it's not the sort of go-to thing to do?
So we are kind of governed by the pharmaceutical industry because we prescribe things which are on a formulary. And so unless those things are on our formulary, we tend not to be able to give them. Whereas you can have a bit more flexibility if people are just going to get their own source of both probiotics and supplements. So after that, up to the age of 3, it's crucial that we're doing things to support the baby's gut microbiome development. And then basically it's at an adult level by the age of around 3. So the things that are happening in infancy but up to age 3 are really important.
And it's a lot of pressure, particularly on mothers, isn't it? To feel, I've got to try and have a vaginal birth. And then, so many women plan and really want to have that experience and it doesn't quite go to plan. And I think a lot of people feel guilt that they did something wrong, and then the breastfeeding, if it doesn't work, having to turn to formula, or because they might have to go back to work much quicker than they wanted to. And then the aftermath of, if a child gets sick and they have to be on antibiotics. I think there is so much pressure on parents to feel like you're doing everything in those first few years. Like the awareness is obviously amazing that we now know that actually perhaps autoimmune conditions that come a bit later could have started from gut health as a child and things like that. Fascinating. But I think it does add a layer of pressure to already very busy parents.
It does.
It's something you have to take seriously, but also try and relax if it's not quite going to plan sometimes, because things don't go to plan.
No, there's no perfect. And the reason that you might have needed something like a cesarean is to save the life of the child and yourself. So we always say, you're alive, your child is alive. And then when it comes to feeding, you need to get nutrition into them. If you can't breastfeed, that's okay. We have all these other options. So that's the main message, is that not to worry because of those things happening. They had to happen for a reason, but there are things that we can do as the child is getting older, so that it's not a done and dusted thing at birth.
That's great. And it's the same for adults as well, you know, in terms of gut health. I've had some really fascinating conversations about how you can turn it around in a matter of months. It's a relief. As someone, I used to have chronic UTIs, and I was on antibiotics a lot for a long period of time. And my gut health is different now to how it was back then through a lot of lifestyle interventions. And obviously with children, they heal much faster in their body. Everything's changing so rapidly that, yeah, that's reassuring to know. For parents who are starting the perhaps weaning journey, this is probably something that's quite fun and adventurous. Do you have any advice for some of the conflicting opinions that are out there about what types of foods little ones should be starting on?
So actually what's good is that the advice has almost come to a conclusion that you should do whatever works for you, but to try and introduce things over the course of the first few weeks quite quickly, and if possible, start with vegetables. So that advice has come through. So your health visitor would be saying that, and your doctor and everybody that you meet would be saying the same thing. So in a sense, that's easier. But then there are these camps saying, oh, it should only be baby-led weaning, where you just leave everything for the baby to feed themselves. And actually, most people do a combination. So they allow baby to explore with their hands, which is one of the most important things of weaning, is for babies to explore food, as well as you start to give them a spoon and put a spoon into their mouth. So doing this combination is generally what people find works. And the one thing I always say is to embrace the mess, because actually the messier the better. So it might feel like most of the food is going everywhere instead of into the child, but that's all part of positive development. So it's giving them that exposure to the smell, the texture, and the taste, obviously.
That's very sweet. I love it. I love the videos when people post like their child, just chaos everywhere. Yeah, it's fun. What's your thoughts on hygiene and things like that? So lots of parents in the past have been very pedantic about cleaning surfaces, about not having children putting things in their mouths which have been on the floor. I have seen examples of little toddlers on the tube with hands on the floor, putting hands in mouth, and that gives me anxiety. Is it important to a degree to be having some of this going on for gut health?
It is important to expose them to the environment, but not necessarily the tube, because that's really disgusting. I don't think I would want anyone to be eating stuff that had been touching the tube.
No.
But if you're in your home, if you know that you've got a fairly good level of general hygiene anyway, there is no harm in babies exploring and you not having to Dettol everything afterwards. So I think people have this understanding now that you really don't need to antibacterial wash and wipe everything. Unfortunately, COVID came in, so we did go back to doing that for quite a long time, and there's a bit of a hangover from that. But I think we should be now encouraging that you don't need to boil everything and take out all the bacteria, because some of them are going to be good for the child.
And you hear stuff about children playing in the garden, perhaps a little bit of dirt going in their mouth here and there as they pick things up is okay and perhaps beneficial.
So I would just put a caveat that if you have animals and you know that there's animals that are going to be pooing in the garden, try and make sure that their baby isn't going to be eating or touching any of that. But otherwise, if it's just, normal soil, then the more the merrier. I think people have embraced having something like a mud kitchen in their garden now, and the kids definitely love it.
Yeah, absolutely. And for those who have a child right now who might be a bit of a fussy eater, I know that can be extremely stressful. My poor parents went through this with me. I was always very, very fussy until I was a teenager. And I just remember my parents just being like, please just eat. And there were about 3 things I liked. And actually, I was a dancer. And as I got a bit older, I was training professionally, and my legs are quite bowed. And I was researching, why did this happen? It could just be genetics and the way I turned out. But one of the theories is, nutrition not quite getting what I should have been. And I was very fussy and, my parents were stressed. A lot of parents go through this.
They do.
Do you have any advice for how you can, because this can go on for a lot longer. This might not just be babies, refusing food. This could be young teenagers. This could be children of all ages.
Definitely. So we know that there's a developmental stage, which means that toddlers and probably up to the age of 3 or so are sometimes suddenly going off anything that has any sort of colour in it. So they just want to eat the beige foods, maybe just particular crackers from a certain brand. So they suddenly become very fussy, which is why it's so important that before that time we've exposed them to all the different tastes and textures as well, because usually they will come back to it, but it might be a gradual process. So what we do want to see is that at around the age of 3 at least, they should be just beginning to open up their palate again. If that child is not doing that at all, or even becoming more narrow, then we would say to seek advice. So again, we're seeing much higher levels of children with more extreme, what we call ARFID. So it's avoidant restricted food intake disorder. And they only would have maybe 7 or 8 foods that they would eat, and they don't cover all the nutrients that they need. So in that case, we would definitely say you need to seek help. You need to be seen at least by a dietitian, and that help is available on the NHS.
Yeah, and I guess a lot of children kind of grow out of it. Obviously, there are others who have more sort of mental health problems to look into with eating disorders in the future. But for a lot of children, it's a phase. And I wonder the psychology behind it, why children suddenly decide they just don't want to eat something.
Well, there are theories around when we were in the caves and when children became more mobile, they were at risk of maybe eating something that was poisonous. So some green plants may be poisonous. So that's the theory, that it's keeping them safe from eating something that could be detrimental. Mm-hmm. Another thing that I've seen is when a child has a choking episode, that can also suddenly put them off. It might not put them off all foods, but it can suddenly put them off. So that's more of an anxiety-related situation. So it's always important to look into the detail of what's happening with the child, because there are many different factors which could cause someone to be fussy or go off foods.
And what are some of the signals for parents who might be concerned about this, that whether you're trying to work out, is this a phase, or is this a sensory thing? Is this a strong phobia, something that's more concerning?
Yeah. So as I said, if you're reducing the number of foods, if the child is reducing their range of foods over time, rather than after that sort of age of 3 or 4 increasing their range of foods, and also if you are concerned that they're looking unwell in any way, so they might be having more infections, they might even look pale, and any other developmental differences that you or somebody else has noticed, then definitely they should be seeking help. But as a basic, all children under 5 have access to vitamins, so they should be continuing to take those. And one of the nutrients which we know can be linked to avoiding foods is zinc. So making sure that whatever multivitamin you're giving has some zinc in it as well.
That's a great idea. And a lot of these vitamins are made with, they do have some of them sweeteners and sugary things,
they do, yeah.
But it's kind of nice as a child, I guess, to have a little sweet treat in there. You've spoken online about creating a calmer, happier environment around meal times. What are some tips you would give for that? So perhaps in our culture, we've lost over the years that sort of family time, which is calm, and it's time for interaction. You know, we've got TVs on, parents arriving late, phones, you know, all these other distractions. How can we create a nice, calm atmosphere?
So it has become busy for people, so that the children maybe are eating on their own rather than with an adult, and it can become part of your to-do list. So I've come home, put the shopping away, feed the kids. And it doesn't then feel like something that is enjoyable, can take time, and that the children can get involved with. So I always say that we should be giving children some opportunity to take part in preparation, even if it's just set the table, put these things onto the table. As if they're taking part in that preparation, then they're more likely to be eating more mindfully, so they're going to be aware of what's being offered. They might, if you have time, even take part in making something. And we know that if children do that, they're much more likely to enjoy it, to eat it. And it's informing them for their future. So it's educating them around, where's this food come from? why are we having it at this time of year? For example, seasonal foods, why are we having strawberries in the summer? So that gives them an idea for the future that this is how we should be nourishing ourselves, rather than just filling our tummies and, being on a gadget or an iPad while you do that, because you don't actually chew properly, you don't necessarily produce the digestive enzymes you need to. So just taking a little bit more time, even if it's once a week, to have that family meal, because that is also another important learning for them and part of their development.
Having those little interactions and giving them your full attention.
Yeah.
Asking questions, showing interest, talking about the food. It seems like an obvious thing, but obviously our modern lives don't always allow for it, which is a real shame. How do you think parents can better model like a good, healthy lifestyle with their children? So do you think it's important to also show them that you're interested in your food, that you're taking your health seriously?
It is. So children absolutely follow what you do rather than what you say. And if they see you thinking about what choices you're making in terms of what's on your plate, how much of things are on your plate, are you exploring new foods, are you trying different flavors, different spices, that will all give them encouragement to do the same. And even if they don't eat exactly what you might be eating, at least they might show an interest. And quite often children want to eat something that the parent is eating, and that's a really positive thing, because then they're opening up their palate, they're being curious about what the food is and how it's been made, etc. So there are many different things around why, as what we do as parents, we should just be a bit more aware. Definitely the keeping a phone away from the dining table is one of them.
And that becomes particularly challenging when these children reach adolescence.
Yeah.
Not just with phones and stuff, but obviously with just teenagers wanting to do their own thing and almost doing the opposite of everything you say. And how do you help people navigate that phase where, again, it's not, sometimes unclear, are they just being stubborn? Is this a more serious issue that we need to look into?
So for teenagers, they are trying to work out what they want. They're trying to work out what's going on in their brains, and they want some autonomy. And I feel that we don't always give them the autonomy that they're craving. So that can also make them just want to do the opposite of what you say. So rather than just telling them what to do, you're giving them choices, you're asking them to play a part, so they're taking responsibility. So I know some people will get their teenager to make the Sunday lunch or, one meal at the weekend. And actually that really is something that quite often they really enjoy, because they're then given free range whereas normally they're just told, oh, this is what's available. So I think involving them, not just at a young age, but also at an older age, it's always going to give them that autonomy and sense that, oh, I can actually choose what we have on our plates today. And quite often they will choose things which are balanced and healthy if they understand that. So having those conversations around what's good for your skin, what's good for your hair, is something that motivates teenagers. Whatever they're motivated by, use that. So if they love shopping, take them shopping with you to buy the food. If they're really into wanting to do well in exams, talk to them about what's going to help them get even better results by feeding their brains. So you do have to use their motivators.
Do you think schools need to be doing more in terms of nutrition and what's on offer? Because it wasn't great. And obviously we had Jamie Oliver back in the day having an intervention, and he improved things, but things probably could be better still.
I would say it's highly variable. So there are some schools that are doing really well and some which are not. So I wouldn't say that blanket everybody's not giving nutritious food to children, because that's not the case. And I know that there are certain people who have actually moved primary schools to making all their own food on site, including baking their own bread. And in fact, there was a programme on the radio about this and how this is now spreading to lots of different primary schools around the country. So we must celebrate that this is going on, and also not worry too much about these 5 meals in the week. So it is only 5 meals in the week that they're having, maybe plus or minus some snacks. And if we can nourish them as much as possible in the morning and evening and at weekends, then it's less important what they're having at school. We also should be aware that lunchtime is their social time, so we don't want to detract from that. So we want them to enjoy their time with their friends. And yes, if everybody's eating the same foods, then they don't feel different from their friends.
It's hard, I guess, as parents, you can't control everything that's going on. And you see often, and I'm sure if I ever become a parent, this will be me, but when they have their first child, absolutely no sugar ever, no treats. And then the kid goes to a birthday party and is introduced to sweets and chocolate, and there's no going back after that. So I guess it is something that I guess you have to at points be like, this is out of my control. And especially as they become teenagers, there's not a lot you can do. If they want to go to the shop after school and buy sweets, they will go and do that. And there's not a lot you can do. In terms of parents who are struggling for time, not that confident in the kitchen, are there any meals or certain foods that you recommend to some of your clients, your patients who are looking to just boost their overall nutrients that are in their diet, but perhaps aren't that confident or don't have enough time to make these elaborate meals?
So we're lucky that we do have good ingredients that don't take a lot of preparation that you can add in. So even if you're adding in something like a frozen vegetable to the meal, or adding in a tin of beans to the meal, you're immediately increasing the fibre, the nutrients, and making it more of a complete meal. So even if you're making something like our go-to for children is often pasta, even if you're making a pasta, you can add in at least 1 or 2 extra ingredients, whether it's 1 or 2 vegetables plus something like a lentil. That generally gets accepted because they like the taste of the sauce. So that's kind of an easy one to start with. That's
a great shout. Thoughts on breakfast as well, because there are still these terrible cereals that you see on the shelves in the supermarkets that were around, and it's amazing that they are still allowed to exist. The sort of Cocoa Pops of the world. I was always addicted to the Nesquik ones, chocolate, and they're all full of sugar. Perhaps the ingredients have got slightly better over the years. It seems to still be an issue, and I think breakfast clearly we know is something that's really important for kids before they go to school, is to have something that will hopefully not spike their sugar levels too much, because they'll get that morning crash, which you don't want when you're trying to focus. No. Is it disappointing what's on offer in terms of when you go to the supermarket and you see that the breakfast aisle? What are some good alternatives?
So yes, the breakfast aisle is still pretty much the same. Yes, some of the ingredients and sugar levels have changed, but apart from that, not much else has changed. And unfortunately, it is the quick and most accepted breakfast for most young children. It doesn't have any protein, and it has limited fibre, and obviously you're not getting any of your fresh fruit and vegetables. So when we try to support parents to change things, we're sort of saying, well, could you have a smaller portion of cereal and on the side have at least some fruit and maybe some nuts, or even something like an egg on toast? So not suddenly saying that's banned, you can't have it ever again. And when we're looking at cereals, can we look at the ones with fewer ingredients, perhaps oats as one of the main ingredients? Or could you actually create a mix so that it's got a bit of some good things as well as maybe the more processed cereal? So we're just trying to move people gradually, because big changes are hard to take on and to sustain. So we don't want to make people feel stressed in that sense.
You see a lot of parents on social media batch cooking for the week, using the frozen veggies. Obviously, you mentioned that's a good one. And the overnight oats, like making maybe a few days in advance, so you've kind of got them in the fridge, because the mornings obviously are very chaotic. We spoke a bit about probiotics earlier and how it's not something that all children will be using unless there's perhaps more of an issue. But for other vitamins or supplements, if there are no specific problems, but parents are just looking to enhance their children's nutrition, is a multivitamin the right direction, or are there any specific supplements or nutrients you think that could help?
So definitely a good quality multivitamin will cover all the basics, but they tend not to have omega-3, and definitely not to the level that we would want. And the majority of children don't eat enough omega-3. So they might not be eating any fish at all. They might not be eating the nuts and seeds, which have a form of omega-3. So we have to look at what they're eating, and if they're not eating any of those, we definitely would be adding in an omega-3. And in addition to that, if you think that a supplement like a probiotic could be helpful, only giving that at targeted times. So say in the winter when there are more illnesses around, it might be that your child could benefit from maybe a broad range of probiotics.
And is it normal for a child to get a few colds, in one winter season? Because
it is.
The whole family often catches things. You see parents really run down and unwell during the winter because they're catching things off the nursery. Why is it actually that you get it more as a child, but perhaps is it because you're building your immune system?
You are. So you're getting exposures to all these cold viruses generally viruses, and each time you're building your immunity against them. And actually you do need that stimulus to the immune system. If you don't have any illnesses, you don't prime your immune system in the way that it's needed in a child. So it's not a bad thing to have a few colds, but obviously sometimes when you first put a child in nursery, it feels like they're constantly unwell. So they go back for a day and then they're home for a day. And it can feel like it's a never-ending thing. And that's when I would say to seek some advice from either a nutritionist or if you have access to a dietitian about what can I do to support their immune system so that they're not constantly unwell. Mm-hmm. And one of the simple things that people can do is vitamin C, because we know that's needed, as well as zinc. So those are the two sort of nutrients that we would initially maybe think about.
And for the infants again, I was meaning to ask you earlier, but we've had in the news recently in the UK that some of these pouches have been higher in things like sugar. What are your thoughts on them? Because I think a lot of parents use it as a supplement in their diet when they're out and about.
Yes.
It's very helpful. Is there a point where perhaps you could be relying on them too much?
So they are definitely convenient, which is one of the reasons that parents like having them. But some people are relying on them for even their main meals. So I would say that use it for when you're just out and about and there's, not many other options. But when you're at home, try to avoid using pouches. One of the other reasons is because developmentally it's not progressing the child's ability to chew, to swallow, to use their mouth in the way that is needed for not only eating but also for language.
That's fascinating, but obviously they're very helpful when you're rushing around and you're out for the day. So hopefully those formulas will be improved as well in terms of what these pouches will have. The ingredients as well as the breakfast cereal. Thank you so much for coming on the show. In terms of where people can find you, you're offering online consultations.
Yes, and I have an in-person clinic as well. So I do see children in London in my clinic in West London. And if you're from outside of London, I do have option for video consultations, obviously.
Great. And where's your website where people can find you?
So it's Health via Nutrition, and I'm also on Instagram, so you can email me through there as well.
And I've seen your Instagram. You've got some great videos on there helping with education. And everyone check out Dr. Venita's Instagram page. And thank you so much for sharing all of your insights. Really helpful stuff. Hopefully lots of amazing takeaways there that people can use and support their children's development, which is really important. Thank you.
Thank you so much.